Hello everyone, I'm Ismail Khattib and I'm going to speak to you today about the USMLE Step 2 CS exam. So first of all, I'd like to speak a little bit about myself. I'm an international medical graduate and I'm SFMG certified with high scores in Step 1 and Step 2 CK. Lastly, I got a high performance on my CS report that was revealed on the 17th of August 2016. Also, I'm a private USMLE Step 2 CS and CK tutor, but today I'm going to talk about the CS exam. Also, I'm going to speak generally about the exam, and I will give you some tips to how to pass the exam. And lastly, I'm going to offer my services to anyone who's interested in such thing. First of all, the CS exam is an 8 hours exam. It's held in 7 centers in the United States only. There will be 12 stimulated patient encounters. Each patient encounter is 25 minutes and is divided into 15 minutes. The real encounter with the patient to take history and to do the physical examination, and then 10 minutes to write patient notes. And we're gonna speak more about this in this video, but not in a detailed manner. You will have to study yourself or to take some sessions as I proposed the first. The exam is divided into, you will have to take 5 cases, then you'll take a little of a break, then you'll have another 4 cases, then there will be a long break with a lunch offered by the center, and then lastly 3 cases at the end. These are photos from USMLE.org. The first photo is the doctors are waiting to enter their encounter, and this is the computers that you will write the patient notes on the desk here with each number of the room and the encounter you are in. Then this is the room. It's a little bit a small room with this examining table, and the patient will be sitting usually, and you will have a chair to sit, or you can stand, whatever you prefer. And at the end, this is a close picture of the desk where you can write your patient notes. And as I told you, these pictures are from USMLE.org. The components of the exam are 3 components. So the first component is they are testing the ICE, or the integrated clinical encounter. It contains data gathering, patient notes, and everything clinical. The differential diagnosis you think about the case, and the closure, of course, is part of the integrated clinical encounter. Secondly, the communication and interpersonal skills, known as the CIS component, and as it suggests, it asks or it tests your communication skills, how you deal with the patient, your body language, your smiling, your eye contact, and how much you are positive in dealing with the patient. Lastly, the spoken English proficiency is the SEP section, and obviously I don't have an American accent, but I passed the exam with high performance. So you don't have to have an American accent, but you have to have a good English, a clear one. Like when you are talking with the patient doesn't have to say every now and then, "Can you repeat that, doc, please? I can't understand you." Or the other side, when you ask the patient, "Can you repeat that too? I can't understand you." So if there's multiple asking of repetition, that may compromise this section. So failing in one component, unfortunately, will lead to failing in the whole exam. And I know many people who failed in the ICE component. So I think, from my experience, it's the most common one to be failed in, but it's not global statistical wise. So globally, I don't know, but from many people I saw, they fail in this section. So first, let's have a look about the encounter. So the encounter, as I told you, and the timing, I told you it's 15 times, and then you will hear the sound outside the room saying, "Examinees, you may now enter the room." So that means that the 15 minutes have been started to count. So you don't have a watch, but you will have the voice and the speaker saying again after 10 minutes, "Examinee, you have 10 minutes left for this encounter." Then after 5 minutes, you will hear the encounter is now finished, and you will have to leave the encounter immediately. After that, the patient notes section, and as I told you, it's 10 minutes. Also, you don't have a watch. How can you know that the time is approaching? You'll hear a sound after 8 minutes saying, examinees, you have 2 minutes left. And then after these 2 minutes, you'll hear the sound, your time is now finished. You're not allowed to touch or to write anything after you hear this voice. So my tips to pass the exam is, first thing, as you saw, 15 minutes is very little time. So many examinees or doctors, they get confused in the 15 minutes and they fail because they are not doing all the components in the encounter that they should do. So the most important thing I would say is time management and practicing until you are ahead of the time. So you have 3 places you will be during the encounter. So outside the room, and then you can enter, and then you leave the room and write the patient note. So the outside the room is very important. Don't compromise it. You will have a blue sheet. You can write some data about it. So when they tell you that you are allowed to start the encounter, you can open the doorway note and you can see the patient name and his vitals. So you can write his name so not to forget about it in the middle of the encounter due to stress or anything. And then you can organize your thoughts in these 45 seconds to 1 minute, as I will tell you later. Then you can enter the room, and then inside the room, the introduction and the history of present illness together with the organizing outside the room, they should take 4 minutes. The introduction and the history of present illness, we'll talk about them. Then the past medical history and the other history components, they will take another 4 minutes. And then the examination, either it's general or specific examination, it will take another 4 minutes. So it's the 4 minutes rule. You don't have a watch, but you should have a good sense of time, and you can only know when someone is saying 5 minutes left. So you should be in the middle of the physical examination, obviously, because 5 minutes is 4 and 4 and 2 minutes. So you should be in the middle in your physical examination, probably finish the general examination at least. Lastly, the closure, and it should be the remaining 3 minutes, is very important component, and you should never compromise this part. You can compromise any one of these, but this one is the most important one, as I will tell you later. And after you finish the encounter, you will have to leave the room and write the patient notes in 10 minutes. So what's the most important minute in all these 15 minutes is the first minute. Why is that? Because it's the minute that you spend outside the door. It's the minute that you organize your thoughts and put a differential diagnosis after you read the doorway information, because the doorway information, as I told you, will contain the patient complaint as well. So you can see maybe a complaint like a fatigue. So you should put in your mind as you will study, there are main 5 differentials for fatigue, where I have a mnemonic for them called Shadia. You can use a mnemonic, or you can just remember the 5 differentials for fatigue. So Shadia, it stands for CHADIA, which is cancer, hypothyroidism, anemia, so depression and infections, and lastly abuse. So it's 6 differential, not 5, sorry about that. And you should ask questions about each one of them, because cancer, you should, for example, ask about weight loss and appetite change. For example, in depression, you can ask about the SIG-IMCAPS, the 9 common questions for depression. You can start by saying 5 questions, and if it's not all or negative, so you can skip the rest. And lastly, if you missed a questions like something like abuse, you can miss the whole diagnosis for this case, and you can miss a very important differential. So for example, you didn't ask if he feels safe or is someone abusing it at his home. So you missed a very important question, and maybe it's the answer for the case. So probably, and as you see, it's just 1 or 2 questions and you missed the whole diagnosis. So do not compromise the differential diagnosis for each case. Why is that it's important this minute? Also because you're gonna be with a stranger for only 15 minutes, and you have to remember the history question, you have to finish in time, you have to think about the diagnosis, all this in just 15 minutes, and do the examination. So maybe you will get stressed So organizing your mind will help you to be in the track. You can write also the differential on the right side of your blue sheet. So inside the encounter, you can look on the right side and ask the questions. Is the thing I did and I got a high performance, so I think it's a good way. My third tip is the introduction. It's just after you enter the room, you have to do all the steps I'm going to tell you right now. First of all, you have to knock the door and you hear a sound saying come in. So you have to say Mr. For example, if the patient, if the doorway information says John Gray, so his last name is Gray, so you have to address him with his last name. So you say Mr. Gray in a question manner. He will say yes to make sure that you pronounce his name in a right way. Then you have to introduce yourself. You can say I'm Dr. ELkhattib, for example, and then you will have to say your role. So you can say I'm part of the medical team, or I'm the doctor in the office today. Anything you are comfortable with to say. Then you should never forget about smiling and maintaining an eye contact. Then you can say nice to meet you and shake hands with him. Then you can ask him if he feel comfortable, and then you can ask him if you could drape him to make him feel more comfortable. Then you can ask him what brings him today, how can you help him, any type of question to start the encounter. And then after he says to you, for example, that he's having chest pain for a few days, you should show sympathy and some empathy by saying, oh, I'm sorry to hear that, it must have been difficult for you, whatever the situation and whatever this phrase you choose to say. Lastly, you can start taking the history by the famous open-ended question, not a closed one. So you don't. It's preferable to start by this open-ended question. Can you tell me about that, rather than saying when did it start, or do you have the other symptom, for example. Then my fourth tip during taking the history, so to not forget about anything in the history, usually we use a mnemonic. So I use this mnemonic, CRB, Smith, Fossett, B. So CRB, it stands for Complaint Review of System, past medical histories and surgical history, medications, trauma, family history, occupational or occupation, social history, sexual history, allergy, diet, and exercise. So sometimes I write them on my clue sheet on the right under each other like this, but just the first letter. So I write CRB, Smith, Fossa, D, and then you should practice them until you are a machine, because the complaint you have to be smart, to ask some question about it to help you in the differential, but the others, they are the same for every patient. So you have to know them and you have to practice them until you are very good and at saying them in a very good and quick manner, so you finish them in 4 minutes as I proposed in the first. Then my fifth tip is about the communication skills. So you should always use transition sentences during taking history. For example, you can say, now I'm going to ask you some question about your health in the past. Or you can say to him, now I'm going to do a physical examination. So you use transitions between the things you are gonna do. Second thing, you should inform the patient what you are trying to do in the physical examination. You should not just open his mouth by yourself or then put a stethoscope on his body. You have to tell him, now I'm going to listen to your heart. Now can you open your mouth for me, please? And say, this is, for example, some situations you should inform the patient. Then you should also use please and thank you every now and then. So you should say, please, can I do? And then when you finish, you can say to him, thank you. You should always maintain an eye contact during the whole encounter. So my sixth tip is to do a general examination in 30 seconds. Many people forget about it. So it's like you're a machine. You should do the general examination to everyone. The general examination can be in just 30 seconds. You are acting here because there's no finding, usually because it's a stimulated patient. So you can tell him, look up for me. You can feel his head, his or her head and face. Just simple palpation, as I will show you later, not in this video, but for someone who will be taking a more detailed session with me. You can tell him, open your mouth and say, can you swallow for me, to check that there is no lump or any thyroid masses. Then you can check his neck for nodes, and then you can do a general inspection of his hand and leg for edema. You should practice until you're always mechanical. Also in this part in the exam, it's the same for every patient and it's the same for all cases. And meanwhile, your mind thinks about what system should I examine next, because you don't have a lot of time. You cannot do a full examination of the body. And as this exam is all about taking a focused history and doing a focused physical examination, so you should think about one or two systems to do your examination on according to each case. Lastly, you will go to the closure after you finish the examination. Do not ever leave the room if you still have time without closing with the patient. Always keep in mind that when you hear there's 5 minutes left, midway between these 5 minutes, halfway in it, you should have already begun it, whatever your situation or whatever how you late, because the closure, as I told you, is the most important one. This patient came to the office to know your recommendation. He's worried and he needs to get reassured by you and to know what's going on with him. After you give him your clinical diagnosis, or you don't give a diagnosis but you just your clinical suggestion, and then you can ask the patient if what you say gives sense, and then you can ask him if he has or her any questions for you, and probably they will have, and it will be the challenge question. You can cut down on history and physical examination, but never the closure. Don't forget about that. Most important tip is practice, 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 practice. So you should practice very well, because this exam is about performing, not about studying and then applying what you study only, because it's all about performing. So you have to perform until you're acting as if a machine, but don't forget you're not a machine, you're not an actor, you are a doctor. The patients are actors, they are not real patients, but you are still a doctor and you will be tested for being a doctor. Lastly, in practicing, you should practice with someone who passed the exam, because he can tell you what you're doing wrong, how to improve, what you're missing. But if you're practicing with the same partner, he will not have this view yet, but maybe different partners can compensate if you don't have the chance to practice with someone who passed the exam. But I really recommend to practice with someone who passed the exam. One of the last things is believe in yourself. Success is simple if you do it in the right way, at the right time, and you're doing it right. So you will succeed. Other than that, don't ask me about why did you fail. And dudes who passed the exam, they are not better or not smarter. They just do it the right way. And you should do the same. You should follow their advice and do the same. Lastly, I'm going to talk about my course. Sorry if I took a lot of time from you. What I'm offering is I'm offering complete comprehensive sessions explaining everything you should do, starting from the outside the room and the history and what to do and the physical examination and the closure, and then how to write the patient notes. And then there are other kinds of sessions who already did this and read by themselves or study by themselves, and they just need me to assess how do they perform. So I also give assessment sessions with full comment on performance, missing points, and ways to improve. Where is that? It can be live sessions through a program like Skype. It's called Zoom, but it's better than Skype, so I can explain through PowerPoints and through a whiteboard, and we can meet in person. You should contact me about where I am and how much is that. You should also contact me. How can you contact me? It will be shown right now, but my last thing to say is do it once, do it right. So it's an expensive exam, it's not a cheap one, so you will have to pay a lot of money. You will have to travel because it's only in the United States. If you are outside, you will have to go to the center, you will have to stay in a hotel or an Airbnb room. You will do a lot of things, so do not compromise studying and do not compromise taking advice and doing it in the right way. Last thing I could say is good luck to everyone. And this is me, and here is my contact data. You can email me, you can Skype me, you can send me a message on Facebook, or you can call me. Right now I'm in Chicago. I don't know next days where I could be, but right now I'm in Chicago if anyone's need my help. Thank you everyone, and hope to hear from you all soon.